To continue our interview series, today we're going to be taking a deeper look into health systems and what influences them in an attempt to shed light on the issues faced by the Indigenous population. Today, I'm going to be speaking with Elena Neiterman, who is a professor at the University of Waterloo, who teaches about health and health systems in order to get a better understanding of how exactly health and well-being tie into the gruesome discoveries of the children at Kamloops Residential School, and more recently, the discoveries in Manitoba. So to start off, I'm going to let Elena introduce herself and speak a bit more about herself, her work, and what she teaches.
Thank you so much. So my name is Elena Neiterman, and I'm a continuing lecturer at the School of Public Health Sciences at the University of Waterloo. My background is primarily in sociology, and sociology is the study of society, which is where from I derive my interest and desire to study health systems. When we refer to health system, we sort of speak about the wider influences of different kind of political, organizational, institutional factors that shape our system. So it includes healthcare system, but it goes beyond the healthcare system to other aspects of institutional, social, and political factors that shape the context in which we sort of experience our health and develop our health, and the factors that shape our health and health status.
Thank you so much for speaking with me today, Elena. I think a good place to start would be what you were just talking about, an explanation of what a health system is and examples of factors that contribute to a health system or a person's health status in the first place.
Mm-hmm. That's a good place to start, indeed. And when we talk about health systems, we can think about different types of influences that we experience in our life. And even if we're thinking in respect to the healthcare system, which is kind of the direct association that most people are thinking about when they're thinking about health systems, you can think about how they've been formed, how they've been developed, and how they've been influenced by various kind of social, cultural, historical, and political factors. So, for instance, if we're thinking about Canada, the way our healthcare systems are designed in Canada, they are kind of the result of the negotiations between federal and provincial government, right? Because we have the differences in how sort of our provinces are organized, and how the distribution of responsibility for health of Canadians is organized. And that have to do with the historical formation of Canada, so how it became a country. It also to a large degree influenced by our cultural perspective with respect to what do we assume to be the primary responsibility of the government, and and then you add on different other aspects of it. So, for example, how those systems are financed, how they are administered, who is in charge, what kind of health human resources system we have in place, how does public health come into place, in which way we have all kind of technology that impacts our health, in sort of different kind of pharmaceutical companies, where do they play a role, and sort of examining these different factors is very interesting for researchers, and I hope for students as well, because it allows us to see how certain factors may shape things differently. So the way healthcare system is designed in Canada, for example, is very different from what we have in the United States, very different from what we have in some other countries. I myself was born in Kazakhstan, so my healthcare system was influenced by the largest Soviet bloc of the vision of what health is about. In terms of doing this comparative analysis allows us to see some of those nuances in how things are structured, how they organize, and how they delivered. From the perspective of the person who is accepting care or lives, you don't always see those big connections right away, but the way that you experience healthcare, for instance, in Canada, you have to come to a family doctor and get a referral to get a specialist, which is not a case in many other countries. So this is something that is the outcome of those larger systems in place that shape our everyday experiences.
How would you describe the difference of how a minority population, such as the Indigenous, and experience their health status, experience health systems in comparison to that of the majority?
That is an excellent question. And I think that the different types of minority populations, right? So if you're thinking about specifically, again, Canadian context, right? Um, a lot of what has been designed by people who participated in the active design. So these are people who kind of had voices. These are people who could have a political influence or political kind of play on their part. These people who may have influenced legislation, right, to some degree. So we know, for instance, that physician strike that kind of erupted when Saskatchewan was trying to implement the Medicare, kind of the history of Medicare really shaped how the healthcare services are being sort of developed or designed nowadays. And we always refer to physician as being a politically active kind of lobbying group that may influence what's happening within the healthcare system. People who do not have voices or marginalized populations or vulnerable populations or the minority populations may not have as much of a political kind of bargaining chips with them or kind of the ability to be heard as people who are mainstream, right? And we sometimes see it even within the context of our Canadian healthcare system. Our country is very diverse, right? Depending on the provinces and specific kind of cities, you see that the members of visible minority groups, for example, may have a huge kind of representation within a particular kind of region, let's say. Yet a lot of our medicine or the way that we provide it is still very westernized, right, and still focuses on kind of the Western principles or kind of specific cultural principles, which may not fit with what is important for that population. I feel like Indigenous population is a whole unique case for the development of health systems because it has been developed in such a way that sort of reinforce some of the colonial relationship that the Canadian government established with Indigenous people. And sort of I think that if we analyze in the Indigenous case, we really should treat it as a very, very unique case because there's very interesting and quite unfortunate events that kind of led to the situation in which Indigenous people kind of found themselves vis-a-vis the conventional health systems that we have across provinces.
How can the relationship between healthcare and the health access to healthcare and the quality of healthcare impact minority populations like the Indigenous group as well? And what is the relationship between them?
Yeah, so if we're speaking specifically about Indigenous people, then again, if we're thinking about the history of colonization and the way the healthcare is kind of I don't know if I wouldn't even say the healthcare system, but the government play and kind of erosion of social trust to some degree, right? Because the relationship were tense. And let's not forget that Indigenous people have their own systems of kind of the vision of health and well-being that are very distinct and unique and sort of thinking about those various factors that may shape their own perception of how health is and how it's practiced, both in terms of self-care and in terms of the community care, in terms of how kind of they negotiate their relationship with healthcare providers. These are they have their own very rich culture, which is not part of the westernized medicine. Not only that, but westernized medicine has been used many times as sort of an oppressive form to impose a certain kind of will or perceptions on Indigenous people. And we have seen again and again the situations where Indigenous people have been discriminated against within the healthcare system and received a lot of negative treatment from the healthcare providers within the sort of larger healthcare system. And there is relationship of kind of distrust, or I don't know if I can even call it relationship, but there is a absolutely kind of understandable level of distrust and disengagement on behalf of Indigenous people when it comes to provision of care from Western communities. And some things that are done, they kind of done maybe not intentionally harmful, but still may have negative impact on Indigenous communities. So I'll just give you one example. the in terms of the reproductive care, for instance, there's been a practice for many years that indigenous pregnant women who are pregnant in remote and kind of communities where a lot of indigenous population may be, they've been flown to give birth in hospitals, right? Because of the lack of adequate healthcare provision, which is historically another factor that contributed to this kind of, tense interactions, because indigenous peoples were oftentimes neglected in the provision of healthcare services, underfunded, and sort of the type of services provided to them weren't enough. So, these women, so imagine as a pregnant woman being flown to a different community where you don't know anybody, away from your family, away from anything that is very important for you to be part of, to give birth to a baby, and then being left alone in the hospital with no support. So this is just one of those examples where the services design are not compatible with what is actually needed by that particular community.
There are, as you said, very long-lasting consequences of colonialism, including like everything that came with it, like residential schools. And now we see a prevalence of addiction and mental health issues in these communities. How can can health systems change, and how can that be possible? And what needs to be done to improve the health status of this population, of minority populations like the Indigenous? And can we create that change as students?
I might be optimistic, but I do believe that change is possible. And I think that kind of steps towards reconciliations are the first steps. You can't treat the bad relationship overnight. So imagine if you have been like in a really, really bad relationship with somebody like for many years. In one day, you cannot forgive and forget everything that happened, but it is possible. And this kind of process of healing and reconciliation is something that I think is very much necessary, specifically within the healthcare systems. We often time talking about the concept of cultural safety. So the idea is that if we are truly to understand or kind of integrate or engage the marginalized communities, and especially indigenous people, in kind of joint dialogue on how to repair and how to make it meaningful, we need to create a space which is safe from the cultural standpoint for the recipients of care, right? So this shouldn't be this kind of power imbalances where I'm a smart doctor, I'm going to tell you what to do, and you're going to be my patient, you're going to follow my advice. But there really is a need to kind of, for me as a healthcare provider, and I'm not a healthcare provider, but that's an example, to take a sort of kind of more of a kind of to take a little bit of humility onto myself and try to listen, try to understand, and try to learn from the person that I'm interacting with about all those different kind of things. I also think that indigenous healing methods and kind of the kind of very holistic way in which traditionally indigenous cultures were kind of perceiving the relationship between well-being and health and all of that is a missing component of our very medicalized health system perceptions, and sort of including that and introducing this kind of vision of the holistic relationship between different parts of the world, including, the land and the living and your community and all of that. This is something that we can certainly learn from indigenous folks. So kind of being able to learn that and incorporate it into our vision, in my opinion, would be kind of another step forward.
Why, and this is the last question, why is conversation and raising awareness so important? And especially when connected to health and health systems, why is it so important for us to continue to make strides like this and have conversations like this and ask questions?
I think because we need to be aware, right? Like we need to be aware, and we need to kind of reflect on that, and we need to learn from our mistakes, and we need to find a path forward. And there are conversations, but the question is how meaningful those conversations are and how profoundly impacted we are by those conversations. It's easy to treat somebody as kind of the other, or like bad guy or good guy, while you don't know people, right? We humans, right? So we tend to think in sort of kind of in-group, out-group things, so that, oh, well, these people are like that, these people are like that, and assign those labels. And in order for us to move past that to more important understanding of the various kind of factors that shape our relationship, it's important to listen. It's important to just listen and recognize and acknowledge some of these things. And I know that for myself, I am an immigrant to Canada, right? So, and although I've been here for quite a while, a lot of history of Indigenous people was not part of my, preparation to the Canadian citizenship exam, right? So, some of the workshops and classes that I took and book that I read, like really opened my mind and eyes to those interactions, and I've learned a lot, right? And learning a lot gives you a step for understanding of where the problems were, how we can move forward, past that. So I think this is why it is so important from my standpoint as well to kind of learn more and listen more, to kind of open up that safe space for dialogue.
Thank you so much for your time, Elena. And this was such a wonderful learning opportunity. Thank you for making conversations about sociology, health, and ethics so much fun for your students. And I'm so glad that people got to have experience a glimpse of what goes on in our lectures. Is there anything else that you wanted to add right now?
No, just I'm very happy to be here and speak. And if anybody ever has any questions or want to have those dialogues, I think we need to do it. And sort of thank you for opening up the conversation about this. It's an important conversation to have.
Thank you. And on that note, that concludes our interview. If anyone has questions about this topic in particular or the previous interview, feel free to reach out to the team at Lawyered. And don't forget to check out podcasts like Media Indigena or websites like Paths to Reconciliation for more information. And